Amina Aisatus Maisise. As the Ministry of Health and Sanitation, they continue for the status update about the COVID-19. Sarah Network then at the National Emergency Operations Center. Let we listen to the official spokesperson for the COVID-19 response team as they give the status update and also respond to some questions.
Everybody, welcome to today's press briefing for the 28th of April 2020. We will start by asking the official spokesperson to do the status report. Over to you, sir.
Good morning, everybody. Today is the 28th of April 2020, and I am sure we are all privy. Let me take this at least for. Remove it. Just the top, just the top.
Okay. Okay.
Good morning, everybody. Today is April 28th, exactly a day after our 59th independence anniversary. And I am sure as Sierra Leoneans, we are privy to the address of His Excellency the President to the nation, commending us as a resilient people. And we know that resilience is something that defines who we are as a people, and the belief and the expectation that though Corona may be doing its own toll, as a nation we will emerge stronger. And so we continue to ask you for cooperation, for compliance with the necessary health precautions, because coronavirus has no vaccine. But if we can't do the preventive measures, the washing of hands with soap or using the hand sanitizer, if we can continue using the face mask, if we can continue the business of social distancing, in those things lie the prevention. And so I'll go to the status update for April 28th. Total cumulative confirmed positive cases, 104. Total number of deaths, 4. Active new cases, 5. Active cases at isolation centers, 88. Cumulative recoveries, 12. Number currently in quarantine, 1,192. Number discharged from quarantine, 1,339. Over to you, Harold.
Thank you very much for the press statement. Now we will go over to the press for questions. If you want to ask a question, you say your name and your media house. Okay. Yes, any question?
Yes.
Yes. Please put on your mask properly.
Yes, Vladi, Momento newspaper. We know the security personnel are really doing some marvelous work in this country. But the Ministry of Health, I did travel from Daru onto Freetown here. What I detected is something like this. It's only hand washing that is taking place, but no temperature is being taken. I don't know how we look at that. If Ministry of Health can do a thing like that so that we can at least let people temperature be taken.
Okay, thank you. We will take round of 5 questions and then we will respond. Yes.
Precious Lady from Pacific Online Television. Yesterday we saw around making on social media about a positive case in prison. So if you could just please clarify for us.
Okay.
Thank you.
Okay, thank you.
Jonathan Tola, SLBC. Case management is still a challenge in the fight against the COVID-19. So what are the strategies to ensure that people placed in quarantine, isolation center or treatment center mandatory?
Please reframe your question. When we talk of case management, we are dealing with treatment or isolation centers. We do not do case management at quarantine facility.
Yeah,
So
the
can you
treatment or the
be
isolation.
can you be clear?
Yeah, so case management is still a challenge in the fight against the COVID-19. So what are the strategies put in place to ensure that people placed in isolation or treatment center?
Okay.
No, I am Swale Okwandi. I work for AYD. My concern is with the e-pass being issued or being applied for by the category of people to be given for the movement. I want to know strategies being put in place to ensure that yes, if I apply for the pass and I get it, there is no way I could transfer that message to another person to be used. Thank you very much.
Okay. Okay. I'm not seeing any hand in the virtual world. But let's just respond to these questions and then we'll continue.
You want to take the first go, or can I start?
Yeah, you can start. Yeah.
Thank you very much. So, Precious spoke about temperature. I think it was Precious spoke about temperature test.
No.
Joseph spoke about temperature test. Momentum newspaper. Thank you for the question. I think it's a valid one, and we all see the need for testing. If you look at what is happening globally, you would realize that the devil keeps coming up once they improve on testing. And that is the need that we also believe is compelling in Sierra Leone, and we have to broaden and deepen testing. This is something that we could see at some isolated spots, even in Freetown. You'd realize before making your way into the facility here, at the checkpoint, they do your infrared test. And they also do this in a selected number of public institutions, and I'm sure they do so in private institutions as well. But looking at the figures that are coming up, about 95-96% epi-linked, and the remaining, which are triggers for community transmission, it tells us we have to get into the serious business of widening and deepening the test. And I think it's the right thing to do. Positive case at Remand Center, we are informed and we say thanks to the Honorable Chief Justice, who has taken appropriate steps. And I think the press release that the judiciary issued yesterday under the hand of the Honorable Chief Justice gives us a comprehensive narration of what has happened. And we know that this case from Eastern Police Station attended court sittings on the 17th, presented illness on the 20th, and I think the test was done on the 24th or thereabout. And indeed, Pademba Road recorded a positive case. The important thing now is, and we know some of those details are contained in the public notice issued by the judiciary. They are doing the necessary fumigation. They have done that already. They have relocated inmates to other facilities. And the Chief Justice has indicated for non-serious offenses, there is a greater inclination towards admitting inmates to bail. That is also a step towards decongesting the remand or the correctional facility. With respect to the e-pass, people ask the question, don't you think that this is something that ought to have been reconsidered? We say no. Not only with respect to COVID-19, but also in other aspects of governance, security, health-related, whether it's agriculture. Technology is today an integral part in enhancing the work of governments and also non-governmental organizations. When we had the 72-hour lockdown, within the period of 3 days, there were over 1,000 applications. It had to require additional manpower. It had to require additional time to process. With the introduction of the e-pass, now you could be in the comfort of your home, you could be anywhere and lodge your application online. If you are a transporter of essential goods, Category 1 of our policies and procedures has clearly stated you don't need a pass for transporting essential goods. if you have food items, if you have beverages, if you have water, if you have medicine, if you have fuel, anything that is an essential good relating to the classes that I have mentioned, you don't require a pass. Once you make your way to the checkpoints, at strategic checkpoints deployed all over the country, the security personnel could make a determination that this is a transporter of foodstuff, and they would allow you to make your way. If you fall under the other category, which deals with essential services, telecommunications, electricity, whatever it is, as specified in the policies and procedures, you have to apply online. There are certain persons who would look at the policies and procedures, and they would say, my own specific activity or my own specific concern is not addressed in the policies and procedures. We have still contemplated your own scenario, and that is why the policies and procedures have advised that you can make your application, you can send it to the coordinator of the Emergency Operations Center. There is a dedicated team for all categories specified in the policies and procedure. There are dedicated teams to look at those applications. And as long as there is justification for the issuance of an e-pass to you, you will get your e-pass. Those e-passes are communicated to the applicants by text notification, and they are advised as to the use of the e-passes. We are advising people strongly, don't subject the e-pass to abuse. The e-pass is not transferable. That is why people who make their applications, their details are logged in, their details are kept in the system. So if there is anybody who is an eventual holder of an e-pass, other than the person who should be the valid carrier, you will be in breach of the regulation, and for that you will pay a dear price. Harold.
Yes, thank you very much to Mr. Turner's question on case management. Case management is still a problem. I don't know what he meant actually, because case management is one of the best things that are happening to us in this country. Because you have seen that even as at today's date, we've gotten 12 cases, 12 discharges, meaning our recovery rate is very, very appreciable. And the case management team is doing a lot, to make sure that people in the isolation centers are given, adequate management, psychological, medical, and even, all what it takes for a case management, for COVID-19. So this is it for case management. And I don't know whether you are also referring to the quarantine centers. Because in quarantine centers, they are not sick, so they do not require nurses and doctors to be attached to the quarantine center. However, there are surveillance officers that will visit them twice or thrice daily to see whether they have any signs and symptoms. And also we have psychosocial workers attending to them and risk communication staff to provide sound and accurate information when they are at the quarantine center. But however, the case management, we have specialists, we have medical doctors, we have psychologists, and all the team, the medical team that takes care of the COVID-19 cases.
Thank you very much.
Yes, yes. Huh?
Question.
Yes.
On the ministry's page.
Yes, okay. Okay, yes. Can you read them for me, please?
There are a few concerns from viewers on the Facebook page of the Ministry of Information and Communications. Someone who is called Usman Ibrahim Saw is asking to get details on how the case, confirmed case at the Panemba Road prison, was identified. And another person is raising a concern. Jonita Koroma is saying that hope the borders have tightened the surveillance because they heard that there is an active case or active cases got missing in Guinea. And other people are raising concerns regarding mud tongues. He's saying I have applied for the pass. Up till now, no response. What is going on? And I believe for now we take those ones, and as they come in, get to know more.
Okay. So, Mr. Jamil.
Well, let's take one more. Yeah.
Okay.
One more question.
Yes.
Yes.
Fali Obandi, again, I have a concern with the response given for question asked by Precious regarding the COVID-19 case at Palermo Road. Now, if I could read the first two lines of the public notice sent out by the Honorable Chief Justice, it reads, the public is hereby informed that one remand center inmate has proved positive for COVID-19 and the inmate is now labeled case 90. Case 90, which tells us that up to yesterday, the response center here knew about this case and never informed the public. Now, this brings to mind that the center, the COVID-19 team, is hiding some information from the public because this is very sensitive. To have an inmate at Palemba being infected with the virus is a concern to the public, and the public needs to know exactly how that case happened. But unfortunately, we didn't get it from the source, that is the COVID-19 team, but rather being given to the public through a public notice from the Honorable Chief Justice's office. Now, I could remember yesterday a question was asked regarding that, and the response given by Dr. Vani was, it is not true. Lamrana of AYB Television asked the question yesterday, and Dr. Vani said, it is not true. So my question is, why are you hiding such sensitive information from the public? Thank you.
Thank you.
Okay, thank you. Study responses and yeah.
First of all, we have to be very forthright with this. I was also in the briefing, the daily update yesterday, when that question was asked, and indeed that was the response that was given. So we are also, as a communications pillar, we are also looking at it, and we would appreciate, as communications persons, when some things happen, you have to also find a way. There are certain protocols that are attached to it. We take responsibility for that, and also we are reviewing our situation, and we continue to reiterate our pledge to provide timely information, and I'm sure, unless for that or perhaps some other isolated cases, but I think the general and wider impression is, as far as communication is concerned, we are owning up to our pledge, and we are making sure that we inform the people. I have been on several fora where I am asked questions whether Sierra Leone should expect more cases, etc., and I have been very forthright. I believe, say it as it is. You should not only be a communications person for things that are good, but you should also be willing to transmit things that may be bad. That's not your own responsibility. I mean, they are not of your making. Your duty is to inform the public, and we should be seen doing that. So as much as we can, but also we have to bear in mind that there are also certain parameters that guide our operations. Matters of public security, matters of public order, matters of public health. We have all of those parameters and considerations that we are looking at. But I can confirm yesterday that it did happen, and that is something that we believe has to be improved upon. Unless for limited exceptions, we should be we should have greater inclination to let the public know, because when the public is fully informed, then it helps them to make better choices, it helps them to be fully prepared, and it helps them in their preventive mechanisms. Somebody has spoken about the Pademba Road case. I think we've spoken about that, and perhaps if that person is privy to the press release, and I think we have to be encouraging our people to use the necessary outlet. If we have put out a press release, and the press release has said it as it is, you don't have to ask us again to repeat what the press release has said. The press release is very clear. You know, the person did make a confession, and that confession is clear in the press release. That person was on quarantine. That person slipped out of the net. That person was at Eastern Police Station. The person attends a court sitting on the 17th, remanded on the 17th, reports illness on the 20th, tested on the 24th. the sequencing, the narrative is very clear on what happened on the Pademba Road case. The positive case that somebody is alluding that escaped from Guinea, this is something that we will investigate. The authorities will be informed, and I'm sure if there is veracity in this, we will make a determination and the public will be updated. Harold.
Yes, thank you very much. With regards to the positive case at Pademba Road, the EOC protocols have been activated and the surveillance teams are now doing their investigation, and they have already done their line listing, and they have categorized the contacts into primary or priority contacts and secondary contacts, and they are still working on that to make sure that they get all the contacts that for that case. Thank you very much. So, yeah.
Yeah, ask your question, yes.
Yes, carry on with your question, please.
Yeah, just on the Bomali case.
Western area.
Yeah, I just want to know
that's it.
if they have done the investigation of the Bomali case.
Well, if they
Since
ask
the
me
minister
for
moved to Bomali without having a pass, so I want to know who issued the pass to her.
Yes,
So I want to know any updates on that case.
Sorry, please. Sorry for
the Bombali case?
Yeah.
Yeah, so what do you want to know about that?
The last time Dr. Vandi said they are doing an investigation on who issued the pass to her, since she's not an essential worker. So I want to know who issued the pass to her. Any investigation done?
Nobody issued a pass to any case, but if it is identified and established that a pass was issued and the person used the pass for any purpose inconsistent with the reason why the pass was issued, as long as that determination is made, the public will be informed. For the 5 cases that have been reported, we want the public to also know that those cases are related and connected to the Western area rural. Harold?
Yes, thank you very much. And in relation also to the pass that you are talking, the passes, they do have serial numbers and they are registered. So as part of the investigation, they are still trying to ascertain who actually gave the pass to that individual. They are working on their investigation. Thank you.
Yes, please.
Yes, Amara Kabo is an advocate for this news agency. How the 2 public cases were being discharged, and also considering the time being spent at the NOB Exposition Center.
Okay, for recoveries, when a patient in an isolation facility, if that patient stays for 3 days without any sign or symptom, then a laboratory test is ordered. If we have 2 negative tests 24 hours apart, it qualifies that patient as a case, as a recovered case. So 2 negative tests 24 hours apart qualifies that person to be discharged. So, and that person is recorded as a recovered case. So that's the protocol.
We may wish to take 1 or perhaps just 2 last questions.
Okay.
Thank you very much.
Yes. Before we close, I actually want to know why is it that the recoveries are done secretly without the knowledge of the press, except we have to find out with it.
Okay, there is no particular reason for that, but I'm sure that once we have disclosed that there are 2 recoveries, it means we have an intention to go public. Otherwise, we would have concealed that as well. But we would look at and see.
Witnessing the operation. That's what I'm
Okay, so this is something we'll discuss as well.
Yes, and the witnessing.
But the good thing about this is, and I think the reason why this is important is, And Harold, you recall yesterday when we were having the meeting with some of our partners, I said that one way the communications pillar could also be scaled up is to make recoveries an integral part of the public education messaging.
Yeah, that's right.
Because once people out there see the recoveries, I think one or two, some of those persons were interviewed by SLBC. So once people at home hear them, and they know that, so then public outreach, public education becomes evidence-based.
Sure.
It makes our work easy. So this is something we would improve on and apprise the press accordingly.
Yes.
Thank you. See you tomorrow at 11.